Hello, my name is Lindsay Vestal. I'm the owner of the Functional Pelvis in New York City, and I'm a pelvic floor therapist. I have found throughout my career that lubricants are a very misunderstood topic, but it's such an incredibly important wellness issue. There's not a lot of information readily available, and when we receive the advice to just start using a lube either in the bedroom or for daily comfort, we're not often explained the ins and outs of our lube choices. This is why I've created this lecture, because as professionals working in the pelvic health field, we can provide this solid, incredibly essential information that can enhance our clients' quality of life, and they are likely not getting elsewhere. So what exactly is vaginal dryness? Well, let's start by answering that question by talking about what is vaginal lubrication. So basically glands in your cervix, specifically from the Bartholin's gland and the Skene's gland, produce a natural lubricant that keeps your vagina moist. This natural lubricant travels down your vagina, which helps to maintain a healthy environment. Vaginal dryness is experienced by 1 in 3 women. You can get vaginal dryness if you go through menopause, are breastfeeding, take contraceptive pills or antidepressants, have had a hysterectomy, or have had cancer treatments such as chemotherapy. These things can cause a change in your hormone levels and can ultimately affect how much vaginal discharge or fluid you have. You can also have dryness if you're not aroused during sex, use perfume soaps, washes, or douches, or have other underlying conditions such as diabetes. As a woman ages, changes in hormone production, particularly estrogen, can cause the vaginal walls to thin. Thinner walls means fewer cells that secrete moisture. This can lead to vaginal dryness. Hormonal changes are the most common cause of vaginal dryness, but they're not the only cause. What's interesting is that most of my postpartum clients who are breastfeeding are often surprised when I tell them their pelvic floor can mimic that of a menopausal woman due to the decline in estrogen production a woman experiences when she is nursing. It can seem really counterintuitive when we're in such a fertile time of our lives, but our body knows no different. When estrogen declines, the effects are very similar. Obviously, it's a temporary condition compared to a woman experiencing menopause, but I also use this as an opportunity to speak to the ability to plan ahead and learn tips about your body that give you comfort now, because you'll be ahead of the curve when the menopausal period of life comes. In recent years, there have been a lot of safe and effective options that have come to market, both prescriptive and over-the-counter, for vaginal vulvar dryness and painful intercourse. Yet studies suggest that issues remain underreported and undertreated, and this highlights the importance of having open discussions with clients and their partners to normalize the need for moisturizers and lubricants across a variety of diverse patient populations. I think education is very important, especially regarding which products clients are using and what sexual activity they're engaging in. It is very important to empower women to start reading labels, not only to see what's included, but what's being excluded from the product. Osmolarity, pH, and additives remain important. We're so focused on reading food labels, we often don't think about reading labels on over-the-counter products. The 2 ingredients that I talk about most with my client population are glycerin and parabens. Glycerin is the main ingredient in most water-based lubricants. Some studies suggest that glycerin increases the risk of yeast infections, especially in those who are particularly prone to yeast. Guess what else it does? It dries out vaginal tissue. What? Aren't they supposed to add moisture? Well, yeah, they are, and they do, but just for that hot minute. Most lubes contain ingredients like glycerin pull moisture out of the vaginal tissue, ultimately leaving it dry, particularly with regular use. Dry tissue is more susceptible to vaginal infections and to facilitating transmission of STIs, sexually transmitted infections. The glycerin in most lubes not only damage the vagina's sensitive tissue, it feeds yeast the same way sugar does. So exposure to glycerin through lube ramps up your risk for yeast infections. Let's take a look at parabens now. They are used as preservatives to increase shelf life, and often they're very commonly seen in lubricant ingredients. They also have been considered a possible hormone disruptor with estrogen-like qualities. We refer to this as an endocrine disrupting chemical. I think it's best to avoid products with parabens if a client is particularly sensitive or has a history of hormone-sensitive cancer. Vaginal tissue is highly absorptive. What we put in the vagina not only has a local impact, but a global one in your body. Parabens and petrochemicals which are in most lubes, are endocrine disrupting chemicals. When absorbed through the vagina, they enter our system and mimic estrogen. This next category is crazy. So stimulating lubes, think like KY heat. They basically increase herpes transmission to women by 9 times. And by the way, they often have crazy chemicals in them to create the heat. They're really just best to avoid altogether. Other considerations that we're going to be talking about with our clients include vaginal pH and osmolarity. We're going to examine that much more closely in just a few moments. All right, so let's examine some other ingredients to avoid. These are ingredients to look out for. I strongly recommend that you don't buy a lube with any of these ingredients. So I'm going to give you a quick overview of some of the more obnoxious chemicals here, but I have a handout that I will provide for you as a great resource for you and for your clients that goes into further detail about why each of these ingredients are less than optimal. So let's just take a quick look at glycerin. Glycerin is a sugar alcohol that has been linked with yeast overgrowth and directly corresponds with increased osmolarity. We're going to get into why that's important in just a moment. Propylene glycol. This is a chemical derived from petroleum, which has been linked with bacterial vaginosis and is a sensitizer, meaning the more you're exposed to it, the more likely you are to have an allergic reaction to it. Non-oxynol 9 and CG, I can't pronounce that one. Both of these ingredients are surface-acting agents, surfactants, which cause the surface tension and permeability of cell membranes. Both are designed to kill microbes in an effect to make them sterile or antiseptic, but this often also kills healthy bacteria and compromises epithelial cell integrity. These often cause a burning or stinging sensation and often is considered an antibacterial chemical that kills lactobacillus, which is a really important substance that should be living in our vagina, but instead this chemical kills it off, which really starts to increase our likelihood of getting infections. Petroleum, that's the last one I'm going to review. Petroleum is an ideal breeding ground for bacteria, and oil itself takes a long time to be cleared from the body. You know, oil doesn't mix with water. So I never recommend it for a personal lubricant when it comes to intimacy. Scar care, play along the vulva area is fine, but we're talking about stuff that goes deep inside either the vagina or the rectum. Oil is just not the best choice there. Let's take a look now at what are vaginal moisturizers as compared to vaginal lubes. So moisturizers are absorbed into the skin and cling to the vaginal lining, the same way natural vaginal secretions do. Like lubricants, they also help to reduce the friction caused by thin, dry tissue. Moisturizers are applied regularly and not just before sex. The effects of vaginal moisturizers last longer than those of lubricants. They can last up to 3 to 4 days. They keep your vagina moist all day. In contrast, lubricants last a short time. They are often used to give moisture to your vagina just before sex or intimacy. Moisturizers work very much the way your normal body lotion does. You may use normal body lotion to keep your skin smooth and moist all day. In the same way, you can use vaginal moisturizers to keep inside of your vagina moist all day. How do I use them? So I usually recommend for most of my clients to use them 2 to 3 times a week, even if they're not having sex. This will help keep their vagina healthy and comfortable. There are several different types of moisturizers that women can benefit from to help prevent chafing with activities of daily living, recurrent vaginal infections, irrespective of sexual activity. The 4 main types of vaginal moisturizers include creams, gels, suppositories, and oils. So creams are basically something you insert into the vagina with an applicator. Some common brands are Replens and Zestica Moisture. Gels are used in a very similar way. They're usually a bit lighter in color and texture. Vaginal moisturizer brand, the Yes Vaginal Moisturizer brand is an example. Suppositories, basically, they're like pills or capsules that you would put inside your vagina. Natural oils would be like vitamin E capsules, coconut oil, almond oil. These oils can be applied with your fingers in and around the vagina. I do not recommend putting oils inside. What are vaginal lubricants? They are not absorbed into your skin. They work by reducing the friction that is usually caused by thin, dry tissue. Lubricants provide temporary relief to vaginal dryness and are usually applied before intercourse since they are immediately acting. Lubricants are available in liquid or gel form. Vaginal tissue is highly vascular, and that means that it absorbs ingredients really well. They basically help to add to your vagina's natural moisture. A lubricant makes it easier to insert something inside the vagina and will increase comfort and pleasure during sex. There are 4 main types of lubricants: water-based, oil-based, silicone-based, and hybrid, and they're basically classified by their primary ingredient. Each type of lube has particular strengths and weaknesses which make it better suited for specific activities, uses, personal preferences, and bodies. If you get yeast infections often, use a lubricant that is glycerin-free and glucose-free. Glycerin breaks down to a sugar in the vagina, and the sugar feeds the yeast in your body, which can cause more yeast to grow. If you have sensitive skin, usually we recommend water-based lubricants, but again, there are many reasons why you may choose one over the other. So let's take a closer look together at that now. So the first 2 types that we're going to more closely examine are silicone and oil. Silicone lasts the longest of all lubricants and are especially recommended for women with chronic vaginal dryness or genital pain. Silicone lubricant is different from the silicone used in breast implants and is not considered dangerous. It cannot penetrate through the skin's pores. Most silicone lubricants are hyperallergenic. Some examples of the stuff you'll see over the counter are Eros, Wet Platinum, ID Millennium, Pink, Gun Oil, and Slippery Stuff. Some of the main pros for silicone are that it's hyperallergenic, it doesn't soak into the skin, it's safe with latex condoms, it stays on underwater, it's odorless and tasteless, and they last about 3 times as long as water-based. Some cons are that it can be expensive, and it can't be used with silicone sex toys. It must be washed off with soap and water if too much is used. Okay, so oil. I've said this before. It's so worth repeating. I do not recommend using oil inside your vagina. Many oil-based products are very hard to wash off and to flush out of the body. Synthetic oils can stay in the vaginas for days. This can lead to pH acid level in your vagina, making it easier for germs to grow. It can also lead to infections in your vagina and urinary tract. One example of synthetic oil is petroleum. Natural oils like coconut and almonds are often safe to use inside the vagina as they're easier for the body to clear, although there is still some mixed research on that as well. They should not be used with latex condoms or sex toys, though. Okay, moving on to the next 2 categories, and that's water and hybrid-based lubes. The most commonly sold lubricants are water-based with synthetic glycerin, which produces a slightly sweet taste. Most flavored lubricants and warming lubricants contain glycerin. When water-based lubes start to dry, it is best to add water or saliva rather than just adding more lube, as water makes it slippery again. Some examples of the common stuff you'll see are Astroglide, KY, Embrace, Wet, Good Head, Revelation, Replens, and Liquid Beads, which is actually a suppository. These are not the brands I recommend, but I think they are worth mentioning as they are what clients will be most familiar with as the ones they'll see at the common run-of-the-mill drugstores. Some pros include that it feels most like the body's natural lube. It's compatible with sex toy material and barrier methods. It's easy to find, it's low cost, it's safe to use with latex condoms, and it doesn't stain fabric. Cons to consider are that it dries out quickly, it's often sticky or tacky, and synthetic glycerin can trigger yeast infection in women who are prone to them. And products that contain parabens or propylene glycol can irritate sensitive skin. They do create some water-based lubricants that don't have glycerin, and if you have recurrent yeast infections, these are the ones to use. They contain vegetable-derived glycerin, which does not trigger yeast infections like the lubes listed above. Some examples are Maximus, Ultraglide, Liquid Silk, Slippery Stuff, and paraben-free Astroglide. Again, these aren't the brands that I necessarily recommend, but I think it's worth mentioning that that's what most clients are going to see at the store. Some pros to this particular type are they'll last longer than lubricants with glycerin. They can reduce irritation to genitals. They're safe with latex condoms and do not stain fabric. Cons are that it can have a bit of a bitter taste due to the absence of glycerin, and they're usually only found online or at adult stores. If they contain paraben or propylene glycol, it can irritate the skin. So fertility-friendly lubes are an important topic. Couples who are trying hard to conceive often have difficulty getting aroused under pressure, and they're more likely to benefit from lubricants. However, lubricants do tend to affect sperm motility, and it's really about the vaginal pH levels. Some lubricants change the level in a way that is negative towards sperm motility. Fertility-friendly lubricants are designed to minimize this. In addition to Pre-Seed, there's Conceive Plus, Yes Baby, and Astroglide. We do not TTC. We do not have clear evidence about which lubricants are better than others, but couples often have so much anxiety around trying to conceive that if you can promote the so-called fertility-friendly products to them, I think it will help to reduce some anxiety. So I'm so often asked, what brands do I recommend? This is an evolving picture, but I like to keep the brands that I recommend current on my website. So you will see a recommendation section on my website. It does group my recommendations by category, the categories that we've gone through here together today in this lecture. So feel free to stop by frequently. I'll always have links and the latest and greatest information posted there. Feel free to share it with your clients as well. I also have a document that I can send you that you can share with your clients as an easy kind of snapshot look at my favorite, not only categories, chemicals to avoid, but then quick links to find those products online. All right, I promised you earlier that we were going to look at plasma, osmolarity, and pH, so let's dive into that now. So do you remember osmosis from school biology lessons? Osmolarity is the measure of dissolved particles per unit of water in a solution, or plasma, which is considered the concentration. The osmolarity of a lubricant is important because the epithelial outer layer of skin is constantly trying to maintain an equilibrium of osmolarity between the skin cells and the lubricant on the outside wall of that cell. Osmosis is the process where water moves back and forth across cell membranes in response to the concentration of chemicals in the liquid. Here we mean lubricant as the liquid. On the outside of the cell, osmosis tries to balance the concentration on both sides. When a lubricant has a higher osmolarity than human cells or bodily fluid like blood, it can be called hyperosmotic. When tissues are in contact with a hyperosmotic lubricant, they try to dilute the lubricant by releasing water. This can cause the cell to die as it becomes super concentrated and no longer able to function. The net result is the layer of cells break down and the body's barrier to infection is compromised. So hyperosmotic lubricants can irritate the skin, cause the barrier layer of skin to be damaged and dehydrated, and leave a mucous membrane, anal or vaginal, more susceptible to bacterial infections or STIs. When a lubricant has a lower osmolarity than human cells or bodily fluids like blood, it's called hypoosmotic. When tissues are in contact with hypoosmotic lubricant, they try to pull water from the lubricant into the cell. This means that a slightly hypoosmotic lubricant would rehydrate dry tissues, but an extremely hypoosmotic lubricant could cause these cells to burst. Most water-based lubricants on the market have a very high osmolarity, somewhere in the range of 2,000 to 6,000. So they are very hypertonic. This can cause fluid shifts in the vaginal cells, and cellular compromise can be one of the biggest factors that contribute to vaginal irritation and worsening symptoms. So a perfect vaginal lubricant's osmolarity would be hypo to isoosmotic, meaning it would have similar osmotic pressure, or its concentration would be similar to the tissues of which it's being applied. A perfect vaginal moisturizer's osmolarity would be isoosmotic, meaning it would have the ideal osmotic pressure to vaginal tissues as it can be present in the vagina for extended periods like 1 to 2 days and will release water as needed. A perfect sperm-friendly lubricant's osmolarity would be isoosmotic with semen, which is slightly higher than typical human tissue. Normal plasma osmolarity is somewhere between 285 and 295 units of measurement. Human semen is a little bit higher, coming in at 250 to 380. All right, let's look at pH now. If you experience burning or stinging when you use lube, the information that I'm about to share will be really important. What is pH? pH is the measure of a solution's acidity or basic quality on a scale from 0 to 14. A pH of 0 would be the most acidic, a pH of 14 would be most basic, and 7 would be neutral. Vaginal pH plays an important role in the immune function of the vulvovaginal microbiome, and it helps maintain the balance of healthy bacteria and yeast and acts against a defense against pathogenic transmission. Vaginal pH naturally changes throughout the menstrual cycle and is closely tied with estrogen and progesterone levels. As the body changes with menopause or other causes of decreased estrogen, such as nursing, the pH of the vagina rises from 3.5 to 5.5 to between 6 and 7. This is a completely natural occurrence, which doesn't necessarily reflect poor health. However, it does leave the genitals more susceptible to bacterial vaginosis, UTIs, yeast overgrowth, and pathogens. When combined with other effects of low estrogen, this rise in pH can create an environment where very acidic lubricants are burning and stinging. Okay, most personal lubricants have a pH value around 4 to 5. So if they're used rectally, especially in a body with lesions, sores, or openings in the rectal mucous membranes, this can cause stinging. Finding a lubricant closer to 6 or 7 might be more appropriate for anal environment. Silicone and plant oil-based lubricants are extremely popular for anal play, and they don't have pH values to worry about. All right, so next up is a really important and very hot topic, and that is CBD lube and THC lube. So CBD oil itself has been kind of a shining star in recent years, marketed to both the general public as a substance that can reduce anxiety and reduce physical aches. Although there is currently not enough studies done to show the efficacy of CBD, especially with sexual arousal, many people have sworn by it to help in all aspects of their health. So I think it does make sense that CBD lube has entered the pelvic health picture to ease both vaginal pains as well as to enhance sexual pleasure. So this is an interesting quote, Sex, Science, and THC. I found it on the Healthline website, talking about how, research does show that THC topical products are absorbed through your skin and mucous membranes, as we've talked earlier. However, there is no conclusive evidence pointing to benefits such as increasing sex drive, enhancing orgasms, or reducing vaginal pain. While evidence suggests that our biological system that regulates our response to cannabis is tied to female sexual function, more research is needed to explore the effects of THC and long-term use. Let's take a closer look at CBD lube now. THC is only available in California, Colorado, and Canada dispensaries. So since CBD is more widely available, we're really going to keep our conversation focused on that. CBD is the non-psychoactive component of cannabis. It has been shown to ease anxiety and paranoia, as well as inflammation and pain. In fact, in 2017, CBD passed a clinical trial showing that it reduced the number of seizures in children with epilepsy. I really think we're on the forefront of a lot more research coming out about CBD. Since we don't have a lot of research to draw on now, I do want to urge us all to be cautious with our recommendations. One of the more concrete examples of us being cautious is, remember that from my research, I found that most companies are really using coconut oil as the carrier for CBD. CBD itself is an oil, but when it's then put into a base of oil, I think that can be problematic. We talked about this earlier. Remember that, number one, you want to avoid latex condoms during sex with using any sort of oil product. They're known to break down or become damaged when exposed to oil. So reach for a polyurethane condom in that case. Also remember that oil-based lubes leave a coating in your vagina and rectum, which can increase your risk of bacteria and infections. It doesn't come out very easily. So I think that's a really important point here. In my recommendations, I do have two products in particular that I have found to be very interesting. One is called Forea, and that is oil-based. The second one is Bella, and Bella is not. Bella is the only one I found to date that does not use coconut oil as its carrier base. Guys, you've stuck with me into this lecture that I think is incredibly important and really under-discussed. It is my absolute pleasure to be able to share this information with you, keep the dialogue going. After all, knowledge is power, pleasure is power, and this topic definitely promotes both. Please remember you can find me on functionalpelvis.com. It's my joy to continue to provide ongoing, continuing education. I do have that groundbreaking course, Introduction to Pelvic Floor Therapy, specifically designed for occupational therapists, but continue to follow me. I've got so many ideas and so many ways to promote and encourage practitioners to better understand positive, accurate information within the pelvic health community. So follow me, and hopefully we can continue to learn together. Thank you so much.